Hi everyone, this is Karini. Today I am going to present radiological equipment. Seminar topic is biological target value concept in a radiotherapy planning. Now see the introductions of radiotherapy. Radiotherapy uses a ionizing radiation to destroy the cancer cell. Goal: deliver the maximum dose to tumor, minimizing to normal tissue. Success depends on the accurate target definition, nutrient, biological and functional imaging. Basics of defining the biological target value. Traditional imaging, anatomical only, CT and MRI. Next, ICRU target value. ICRU value focus on the tumor geometry to ensure the covering during treatment. However, they don't account for the how tumor biological affect the radiation responses. There are 5 units: cross tumor value, clinical target value, planning target value, organ at risk. Next, need for the biological testing. Tumors are not uniform in a cell composition. Areas may differ in the oxygenation, proliferations and metabolism. Hypoxia or rapidly dividing the cell, resist radiation. Uniform doses deliver the maximum under the treat resistant areas, lead to recurrence or incomplete tumor control, derives the need for biological based dose adaptation. Biological target volume focus on the tumor biological rather than the structure. It defines the radiation delivery based on the tumor function and molecular activity, improving accuracy and outcome. Introduced to include biological characters in a planning. Identifying the via functional and molecular imaging include the zone of high metabolism, hypoxia and proliferations. Next, definition of biological target value in ICRU and research. Biological target value is defined by the biological function, not just a physical presence. It allows the radiation oncologist to treat tumors based on how cells behave the response to the radiation. Encompasses regions of varying radiosensitivity, help adapt to dosage the tumor behavior. Basic for biologically guided radiotherapy. Consider the oxygenation, metabolism and proliferation receptor recursion. Functional and molecular imaging. Functional and molecular imaging provide the biological information at the cellular level, making them the essential for identifying subregions within the tumor that form a biological target value. PET, SPET, functional MRI identify the metabolism, oxygenation, proliferations and offer voxel by voxel biological mapping. Next, PET tumor metabolism. PET tumor metabolism imaging by detecting the high glucose uptake, which are characteristics of most of the cancer cell, delay the anaerobic glycolysis. Patients are injected the radioactive glucose analog. This is technique used for the diagnostic strategy, monitor treatment response by accessing tumor aggravation and viability. Next, hypoxia imaging in a biological target value. Biological target value is a region within a tumor defined by the specific biological characteristics such as hypoxia. Hypoxia imaging in a biological target value therefore uses a advanced medical imaging technique to precisely mapping and quantify low region area within the tumor to guide the more effective targeted cancer therapy. Next, proliferation imaging. Proliferation imaging in a medical technique that uses a trigger to visualize and measure a cell growth in a real time. It is a non-invasive way to access how rapidly cells are multiplying, which can help diagnosing disease and monitoring the effectiveness of treatment like chemotherapy and targeted therapy. By the mapping cell, help identifying the rapid growing tumor regions which often require the high dosage or close monitoring during radiotherapy. Functional MRI in biological target value. Functional MRI is the advanced neuroimaging tool that providing a crucial functional information for defining the biological target radiation therapy, particularly for the brain tumors. The brain function detecting the blood flow associated with a neural activity while minimizing the exposure to healthily functional brain tissue. The integration of fMRI into a biological target value denialization is a process critical when the tumors are located near or interflating functionality essential areas. Image fusion and regression. Image fusion is a truce an MRI image overlay to the no fusion rigid. There are two classifications, rigid and elastic. Combine the CT, PET and MRI data into a one coordinated system. Image fusion align with the multiple imaging modalities, ensuring biological map that PET or precisely matches with a CT based planning. Image fusion is a combine multiple images into a single composition image, while image regression is a process of spatially aligning two or more imaging to a common coordinated system. Segmentation and countering. Segmentation and countering of a biological target value is a critical step in the radiation therapy to ensure that the precise dose is delivered accurately to the tumor while sparing healthy tissue. A biological target value is a specialized target value. It incorporates the metabolic and functional information from the molecular imaging, typically positron and SPET and CT. Segment and identify the biological active subregions. Dose level. Dose level is a precision therapy technique that assigns radiation dose according to the tumor's biological map. Ensure the each doses get appropriate dose. Non-uniform dose distribution within the tumor. Reduce the exposure to the normal tissues. Biological optimization. Biological optimization uses a patient specific tumor characteristic to fine tune treatment planning, ensuring optimal balance between the control and safety. It includes consider the radiosensitivity and hypoxia in a planning optimization. Objective maximum of TCP and minimize of TCTP. Next, tumor control probability. TCP is self-identified how effective radiotherapy plan will be by increasing the dose in biological resistant areas, mathematical model predicting treatment success, improve your control and aggressive regions. And NTCP National Tumor Complication Prone, it is a model used in a radiotherapy to estimate the risk of radiation introduced to may damage healthy organs surrounding a tumor. These like with the complication helping clinician optimization treatment plan to minimize risk of while. Here are three important treatment planning, patient selection and treatment optimization. A planning workflow is a three steps. First, tumor growth, biological view and biological target value. Case study, head and neck cancer. Head and neck cancers or of it hypoxia identifying the boosting the subregions. Radiotherapy become a more effective and reduce a relapse. Case study 2, glioblastoma. Glioblastoma show a irregular metabolism based biological target volume planning focus on the radiation where active is the highest, delaying recurrence and improving survival. Third one is lung cancer. Lung cancer combining a 4D CT improving accuracy, allowing clinician to boost metabolically active area while minimizing the normal lung exposure. Selective dose escalation within a tumor, avoid the excessive dose to the normal lung tissue, improve the tumor control and TCP. Advantages: personalized radiation therapy, better tumor control, reduce recursion rate, low toxicity in NTCP, integrate functional imaging biomarker, enable the radiotherapy. Challenges in BTV: complex imaging, fusion and registration, biological threshold and standardization, limited access to PET, increased planning and computational time, need for the clinical validation and justification, uncertainty in a biological parameter stability. Next, technological requirement: PET or CT, PET or MRI hybrid system, advanced MRI or IGRT for accurating setup verification, software for biological optimization, real-time monitoring tool, strong image registration algorithm, adaptive radiotherapy, monitor biological changes during treatment, uptake plan based on a tumor responses, require the repeat PET or MRI scan, dynamic adjustment video dose treatment, improving long-term outcome. Thank you, ma'am.